I just finished reading your module on USP800 and I have a few questions. Are these standards?
Yes, USP800 are new standards to protect healthcare workers from exposure when they're handling hazardous drugs. Now, these standards will apply anywhere hazardous drugs are used. So, if your facility receives them, stores them, transports them, administers them, or disposes of them, then these standards will apply. The new standards will be official and made enforceable on November 1st of this year. This means that the Joint Commission and the AAAHC will be surveying for compliance. So, do you use hazardous drugs in your facility?
In our surgery center, we had used the mitomycin C for our cases. Now we use the mitosol kits for ophthalmology. We use very little of the drug. Does USP800 still apply?
Yes, they do. It doesn't matter if you're using a small amount of the drug or a low dosage of the drug. If the drug is hazardous, then you must follow the standards. We have to start thinking about hazardous drugs like we think about sterility. We never say, oh, it might be sterile, or we think it's sterile. It either is or it isn't. It's a black and white issue, and it's the same with hazardous drugs. So it's probably in your best interest to do the risk assessment because the mitosol kit does have many safety features which will help with compliance.
Good to know. Does my facility still need to be compliant?
Yes, and it's more than just during the administration of the drug. You need to make sure that you're following the standards, anytime the drug is being handled. So the best thing to do is to start with a gap analysis. And that's where you'll look at your practices from the time the drug enters your facility until it is disposed of. If you find that there are times that you're not following the standard, then that's a gap in compliance and you will take corrective action. Once you do that gap analysis, then you can do a risk assessment. Now, the risk assessment is there for you to determine whether a particular practice will cause an exposure of the drug. The risk assessments are voluntary. However, if you don't do a risk assessment, then they will expect you to follow the standards as written.
Is this something you can help me with?
Absolutely.
Great. I look forward to it.